And because inclusion isn't just about who you include, it's also about the things that you design, who they reach, whether people trust them. Um, what does a truly inclusive women's health platform do you think would look like for you?
I think when it comes to truly inclusive is that it's not exclusive as well. So as you speak to those areas, is knowing who you're designing for, um, and making sure that it doesn't exclude through design where you've unintentionally design people out of using your service. So it might be a language barrier, it might be accessibility for vision, and looking at where you best play a role in that. So an example that springs to mind is pregnancy tests. That you just buy from the supermarket and you use without a thought. What a founder that was visually impaired herself was like, how do you do a pregnancy test if you're visually impaired? Like, how you shouldn't have to have someone else find out you're pregnant before you are,
That's a really
which
good one. I mean, that's one you wouldn't even think about unless you have that challenge, right?
exactly. So it does take her then a dedicated innovation like that, and looking at how do we make that a sustainable product that can be commercially viable, reach the right people. And I think partnering through partnerships, but also looking to those bigger companies that have gone before you to really support that. That's where I think innovation can really come to life as well. So in reality, some products like a pregnancy test will exclude people like visually impaired. So then it's looking at how do we solve for that as quickly as possible as well.
Yeah, I think you make a really good point. When you talked about the fact that as a founder, you're almost kind of always you're forced to balance that equation of trying to build for more than one view, one more than one description of what perhaps a woman needs, and also try not to put yourself in a pickle, right? By overspending or yeah. So we're seeing because we're seeing so many startups entering this space, femtech space, which is really exciting, but also raises that question: how can finders avoid building solutions that always only work for a small group of women, for instance, without necessarily burning themselves out, like you said? Well, what have you seen happening in this space? How are they handling it?
And that's a really key area where, especially around price and accessibility, wearables, for example, we know are really only available to the most affluent. When you've got a smartwatch or a smart ring, which comes into the hundreds of pounds. And so actually it's saying that preventative health is only available to the few. And again, I try to take a step back and look at what other route could have happened, what else could have happened there. And what's, I think, promising is that now these businesses are commercially viable, sustainable. There's they can look at how do they make their product free for certain communities. Wearables were mentioned in the Women's Health Strategy Refresh, for example. There's going to be trials in communities, particularly on cardiovascular health for women, to see if that can be used for preventative health. So it's then partnering through the NHS to get those to people that would not have had access otherwise. So I think as a founder, you need to decide, where that comes in your journey. If you're able to build for a specific demographic right from the start and make your pricing really work for all from the start, or whether it's you've got a strategy for that further on. Because I do see founders that have this desire to make their product free for all right from the start. Period apps is a really prime example of this, and then they don't exist a year later because you can't pay yourself with thin air. And that's the harsh reality of this, is really taking that sort of strategic thought about what what works, but what delivers outcomes.